In Australia, the majority of women give birth in a hospital, and there's various models of care that they can have in a hospital. So they can go from the public sector, where we have tertiary hospitals, which are often referral hospitals, where a lot of technology, a lot of intervention, to birthing centres in those hospitals where it's low technology and low intervention, and about 0.6% of women have a planned home birth in Australia at the moment. Probably 99% of women will deliver in hospital, and it depends whether you're in the private or the public sector. And currently the statistics show that it's about 2/3 in the public sector to 1/3 in the private sector. We go from the really high-tech, all the bells and whistles, and if you've seen the Monty Python film, The Meaning of Life, the machines that go ding, but certainly that model needs to exist for women that need that type of care. But a lot of women don't know that they have a choice, that they don't have to go and see a doctor for their pregnancy and birthing, but they can in fact go and see a midwife. And midwives are more and more working in hospitals, in antenatal clinics that are run by midwives, right through to group practices where the woman can see a midwife the whole way through her pregnancy and through her birth. And she births in a very low-tech type area. Obviously there are requirements that have to be met for her to meet the criteria to go into that model of care, but that type of care is available for women. And if you think about it, we can go from the high-tech, which is obviously high technology, high touch, right through to models of care where they see the midwife and it's relatively low technology but still high touch care, if you like, right through to using a birthing kit in a developing country where you've got minimal equipment but something that's going to make a difference to those women birthing in that area. And you only have to compare the delivery sets that we use, for example, when we're birthing with women here, to the birth kit that's being used in developing countries. I think it's very interesting when you look at the two birthing kits or the requirements that we need for a safe and clean birth in both areas. For example, in a hospital we have quite a large tray. Some people have gone down to a very small tray with just minimal equipment on it. To comparing that's been through a steriliser and has big metal equipment, etc. on it, to the development of the birth kits, which comes in a very small package and has all the requirements for a clean and safe birth in the developing countries. Of course, the kit that we have for hospitals doesn't need to have the black plastic because we take for granted that we've got nice clean sheets to birth on, or on the floor, or wherever the woman's going to have her baby, but there's always a clean surface to birth onto, where in the developing countries we certainly need to have that plastic for the woman to birth onto. Having the clamps, you compare the size of the metal clamps that we put on the babies here, it would be much nicer to put the two little cord clamps straight on rather than this poor little newborn baby having a big metal clamp on. So everything that's required for a safe, clean birth is in both kits. But when you compare the two, certainly the birth kit has got a lot of advantages. And the other advantage is, of course, that it's a one-off, one-use, single use only. I think one of the really crucial issues in all of this is that the World Health Organisation hopes that every woman will have a skilled birth attendant with them when they're having their babies. And that, for me, is really significant. So here in Australia we train midwives, or we educate midwives for midwifery practice, but out in developing countries they don't have midwives, and so we need to make sure that there's training of birth attendants so that all the women can have a birth attendant with them. And if we can get those birth attendants trained, give them a birthing kit, then we can ensure that those women are birthing with the trained attendant and in a safe environment. And certainly the program that we have here in Australia, many of the midwifery programs, students from those programs have the opportunity to go and work in developing countries. And certainly from my experience at Flinders University, our students have had the opportunity to go to developing countries and work. For example, in East Timor, and recently in India, and also in Ethiopia. So they've seen the birth kits in action and report back to us how fantastic it is to see them being used. I believe that we're going away to meeting the Millennium Development Goals, and certainly our contribution through midwifery is really important. With the birthing kits, we are looking at Millennium Development Goal number 5, where we're improving maternal health by providing a safe, clean place for the women to birth, and also the Millennium Development Goal number 4, where we're looking at trying to reduce infant mortality rates using clean, safe equipment is really important. So, for example, being able to tie the umbilical cord immediately after birth with a nice clean piece of string, for example, is really important. Similarly, in hospitals where we can clamp the cord straight away. But certainly out in the field where you're using things like birthing kits, that is going a very, very long way to improving those Millennium Development Goals.